The first surgical operation developed to directly treat spasticity is called the selective dorsal root rhizotomy. It was actually initially described in the early 1900s, but it was significantly improved, made safer and more effective by the 1980s, and it's now well established. It is an operation that can calm down the parts of muscles which are particularly abnormal in their tightness. This operation begins through an incision in the middle of the low back with a technique to lift up the roof of the bony space where the leg nerves are found within a spinal fluid-filled sac called the dura. Opening that dural sac gives a neurosurgeon access to those nerves. Then special electronic testing done at the time of surgery identifies each of the dorsal sensory nerves. These are the ones that carry sensory signals coming from the leg muscles and traveling up to the spinal cord. Each dorsal sensory nerve is then divided into several parts called rootlets, and each rootlet is tested for abnormal electronic signal spread into the muscle. That demonstrates which rootlets are carrying the most abnormal signals. And then those most abnormal sensory rootlets are cut. About 60 to 70% of the abnormal rootlets are cut, but which specific rootlets are cut is very individualized for each patient. But the positive, long-lasting beneficial effects of this operation are that it gives reduction of muscle tightness, decrease of muscle tone, improvement in range of motion, improvement in muscle function, and in some cases, with the help of physical therapy, can also improve the patient's ability to walk. It has some limitations. It's more beneficial in the lower extremities, not as beneficial in the upper extremities. Also, its effects cannot be altered. It's a definitive procedure, and therefore one has to be careful that the patient has enough intrinsic strength so that after you do those cuts, you don't unmask an unusual amount of weakness. So there's a great deal of caution that has to be made. Certain patients are well suited for the operation, others are not as well suited for it.